So you have more compensation by speed and frequency instead by the volume of the pulse when you have weak force. If the force become weak, more weak because of a chronic disease, for example, we have more compensation by frequency. And if the force become extremely weak, the nature surrounds itself and do not try to compensate any increase of the need. So you can see a pulse like movement of ant or movement of a worm in the patient that is near to this. There are some normal compensation by speed instead of volume. When we compare men to women, in a woman body, because force is not as strong as in the man body, compensation is more by speed instead of the volume. In an infant or a child, compensation is more by speed compared to a young people, compared to a young person that his or her force is completed. And if we compare an athletic to a regular person, we can see that in an athletic body, compensation is usually by the volume of the pulse. Athletic have usually a slow and distinct pulse, but their need is not decreased. We have a slow and distinct pulse in decrease of need, but in an athletic, in normal need, we have large but slow and distinct pulse compared to regular body. These are some examples that when you reach to a rapid pulse, you should ask yourself if the force is weak, and if it answer is yes, you should ask why. You should notice the causes of the weakness. I mentioned it in a section that is related to spirit. Dissolving of spirit, for example, through a open wound, through an expelling method, too much sweating, little food consumption or starving, that they are all cause of the weakness of the spirit and the force. Or in chronic disease, in chronic distemperament, usually we have weakness of the force. If you reach to diagnosis of the weakness of the force, you should search for the causes of the weakness. And sometimes you have normal reasons. I mentioned it. If you reach to a slow and distinct pulse, in a small pulse in 3 dimensions, in a hidden pulse, in a cold pulse, you should ask why the need is decreased. The most important causes of decreasing in need is coldness. You should ask the causes of the coldness, or search the causes of the coldness in your patient or in your healthy person. Sometimes a cold bath, swimming in cold water, cause coldness. Sometimes using cold temperamental food or cold temperamental medication cause coldness. Sometimes stillness cause coldness, or too much sleeping cause coldness. You remember the causes of coldness from previous sections. That's how we reach to a diagnosis by the pulse. You should practice pulse detection, but do not rely on it at the beginning. You should become expert to taking pulse. And by taking both hand pulse, because sometimes one hand show normal pulse and the other hand show pulse of disease or distemperament. And sometimes you have two different distemperament in two sides of the body. So one hand, for example, show cold distemperament and other hand show warm distemperament. You should examine both hands, both radial artery, and you should take notes. It helps you to, when you come back to history of the patient and you evaluate the pulse and compare it to the new situation, the next visit, you can learn more about the pulse. Usually the pulse is a chapter that is discussed in advanced courses in Iranian traditional medicine. But in my opinion, you should practice at the beginning by detecting pulse. Examine your pulse in different situations, both hands, after bath, before bath, after sleep, before sleep, after exercise and before exercise, and compare them to each other. This helps you to improve your experience and your ability to taking pulse as healers or physicians. Detecting pulse and its interpretation helps you to reach faster diagnosis in the medical office. It helps you to more exact diagnosis